Hello, everybody. Thanks for joining us again this evening in our monthly webinar series. We have Denise Merdich back again with great response and huge requests. So thanks for your time again, Denise. Denise is a nurse practitioner and master injector in the state of Florida, and also is the owner and CEO of Astra Institute, which is a phenomenal training institute down in Tampa. And we are just thrilled to have you back. Thanks again for joining us, Denise.
I'm so glad to be here.
So tonight we're going to be talking about Renveau. Renveau is our newest, latest, and greatest technology on the market, helping to plump and firm the skin using liquid PDO and hyaluronic acid. But before we even dive into what Renveau really is, let's talk briefly about the history of PDO, because that still is a new term to some people. Using polydioxon has been in the suture world for over 30 years and is known worldwide for its safety and efficacy and its overall reliability. Denise, how long have you been using PDO?
I work in a plastic office and, we've been using PDO in the OR for 24 years. So I was very familiar with the ingredient of PDO sutures. But I've been using the PDO in the suture world, non-surgical thread world for now over 10 years. And it's just amazing what threads can do and how they can remodel the skin and how they can pull for some people. So it has such versatility. We're already confident with what it can do in the face as suture material and lifting and pulling and building. So adding a topical is just going to be even better.
And we all know that Renveau is a serum, basically, and it's just a sterile, biodegradable collagen stimulator that truly is next generation. It can be placed topically like we recommend, or with microneedling channels and microneedling device, any type of fractional or ablative laser, basically just about anything, anywhere on the body. Doesn't have to be just on the face. And the magical thing is, Denise, you've got a vial right there. Each 10 milliliter vial can treat up to 3 patients or 3 treatment areas and is equivalent to over 1,000 mono PDO threads. Hold that puppy up there, Denise. I want to take a look
Yeah.
at it.
It's simple. It's like a little powder, and I'm going to get really close so that you guys can see that. But it's a little powder and it's compressed into this bottle. And, when you think about your patients and using it, yes, you can get 3 different people out of this, but it may be that, your patient may be on the older side, may have lots of lines and wrinkles. They may need this whole bottle, and so there's so much versatility in that, but you have to hydrate it. So it is kept on the shelf until you want to use it. And then you have to hydrate it with some saline, and then it actually is ready to use. So it does take a couple minutes to hydrate because look at how many, how many threads are in there. So it takes a while to reconstitute this. So, do it ahead of time so that doesn't interfere with your actual practice. And then you can draw it up and then use however you're going to use. That's the flexibility of it.
And it comes in powder form, is really nice for just the overall stability and storage and longevity. And you can get creative with how you mix that as well. And we'll get into that in just a moment. Overall, you've got 70% of PDO and 30% hyaluronic acid in that vial that Denise was just showing. The hyaluronic acid is non-cross linked, so it will actually help carry the microparticles of PDO that have been sized for optimal absorption into the derms. Today, we are going to be watching a treatment video by Lorraine Kay, who is a very astute nurse practitioner at R3 Anti-Aging in Brentwood, Tennessee. And she is going to be showing us how she microneedles the Renveau into her lovely patient. And let's just dive right in and take a look.
My name's Lorraine K. Commissar. I'm a family nurse practitioner. I work in the aesthetic field. And today, my patient here, we're going to do some microneedling with the Les Encres Renveau serum with the Rejuva. All right. Think you ready? Our face is already washed and had a little bit of numbing cream put on. Does that feel okay? All right. Now, this product is both hyaluronic acid and a PDO powder. It is really good for elastin production and collagen production. And basically, over the next couple of days and weeks, my patient here is going to essentially see plumper and glowier skin from using this product. We're just kind of microneedling it into for dermis here. I'm going to adjust the depth of the needles just depending on the tissue. I go a little bit deeper if any of my patients have any like really good acne scarring, any really deep wrinkles. This product will just get deeper into the dermis and have a better effect if we get in there a little bit deeper with it. So for the chin here, I'm at point. We don't have as much tissue here. But all these little fine lines right here, basically this works for any patient, this product, but it's really best for kind of that older dehydrated skin because it's really gonna hydrate and plump this right back up again. She's gonna feel tighter. This product, you know, we can use several different things as a glide for these needles. What's been on the market for a really long time is obviously drawing your own blood and getting PRP from that. You can also add exosomes to it, which basically just puts fuel on the fire. It's great. But this product, when you add it in as the glide, is a really good adjunct to the PRP. It's obviously a little different. We don't have to go through drawing blood and putting it through the centrifuge. A little bit easier, but they are all biostimulators in their own way. This is just so much easier. Just reconstitute the vial and away you go. Because of the hyaluronic acid and we're just getting it in there, she's gonna have an immediate plumping from this. Immediate results on the hydration. And then the biostimulation from the PDO powder is just gonna keep getting better as the weeks go on. We're doing really shallow depth here on the forehead just because there's not a lot of meat up here. But just the same benefit. Still doing okay? I know the forehead can be a little bit spicy. I've only used 0.5 and I'm halfway done, so once I get done with this first pass of microneedling, I'll use what's left and just massage it in for her to get a little extra oomph there. The downtime with microneedling with this product is going to be the same with any other microneedling procedure. It's really the needles themselves that can be a little bit pink afterwards, maybe a little bit of flaking in the next couple of days, but very low risk of any adverse reactions with this product. Your skin's gonna love this because it is soaking it up already. Your cheek on this side. Gonna increase the depth to 1.4 millimeters again. How's it feeling on this side?
Not too bad.
Okay, I like to go over a couple more times in these areas where the skin laxity is a little much. Really get this product down into those spots really good. So one vial is good for about 3 patients worth. So just depending on your area, where your practice is, what the going rates are, you'd obviously charge whatever you charge for a normal microneedling session. And the upcharge on it, just depending on your area, $250 to $450 is usually what people end up doing with this product. The vial itself is $199, and that's good for 3 people. I'm just gonna go over one more time over this crow's feet area because I think that this product will be very beneficial in this area for her. And you can get a little bit closer here, just as long as you're really staying to like the 0.25 millimeter right under here. Really helps with pure discoloration for folks. Some people who have a little bit of a tear trough deficit but maybe doesn't want to do tear trough filler is a really good alternative to keep it revitalized, plump, help with the discoloration. My patient has some texture here on her chin, so I'm going at 0.8 millimeter, maybe a little bit deeper than I would on somebody else, but I think that the product would be really beneficial for her chin texture she has. We're almost done, Sally. Almost made it. Now what's really important is for this product, you want to make sure that the patient can try to leave it on their skin for 24 hours, which seems like a long time, but we really want all of this to seep in as best as possible. I feel like probably the best time to schedule these patients, I would, for myself at least, I would suggest in the mornings. They can just go about their day when they're gonna look red anyway, and then they can wake up the next morning and wash their face. So I've finished microneedling her face. I have a little bit of the serum left, so I'm just gonna drip a couple drops in each area, just rub all that goodness in. Every last drop counts.
To help get rid of those crow's feet and the dark spots and the wrinkles and plump up my skin, yes.
Which it certainly will. I went over your crow's feet more, and the deeper lines, and I did go deeper on your chin by like a 0.5 millimeter more than I normally would because of your texture. So, well, we'll see in a couple weeks and we'll see how much better it looks.
Oh, I'm
Yeah?
so glad.
All right. Well, thanks, Sally.
Thank you. I can certainly use the glow.
Did it hurt?
There was a little stinging, a little bit, but it's normally hard for me to get numb. So that's not unusual for me, but it wasn't anything at all that I could not tolerate. No more, certainly no more than getting Botox.
All right. I think you can all see the results are immediate. The plumping, the firming, it's truly just revolutionary. I get so excited every time I see something like this. And our lovely model that we had here in this video, she had some crepey, fine skin. And that's the beautiful thing about Renveau is just about everyone's a candidate. The beauty is that most people are good candidates, whether they're male, female, young, old, and each treatment takes about 10 to 15 minutes, as you can see. So Denise, having just watched that video with us, do you have some feedback or tips or tricks that you like to use when you microneedle Renveau?
I always say, don't get caught up on the microneedling itself and, oh, I don't do it this way, I do it that way. I have a special technique. I say, I mow the lawn one way, do it another way, and then I go in swirls. So my hashtag swirl technique is my technique. I just have to make sure that I puncture the skin enough that something is going to seep into it. So whatever that is, in this case, it is our specialized powder that we are actually seeping in. We want to make sure that we are getting that hyaluronic acid in the PDO threads into the skin. So if you don't go deep enough, you may not get it into where you need to go. So I always say, make sure that you're creating a little petechiae when you're doing it and that you seep it in. And you will see that it seeps in very quickly. That instant plumping becomes, you have 12 oscillating needles poking the skin, and that's going to give you some instant plumping along with the HA gel. You will see that instant plumping, but you're going to actually get more rewards out of that than just what you're seeing immediately in the treatment.
Excellent. And we did have a question in the chat that popped up during the video. Again, the depth that should be used as a standard is about 1 to 1.5 millimeters for major fibroblast stimulation and regeneration, and then about 0.25 or 0.5 for major hydration. Is that a fair enough statement, Denise?
That's a good rough estimate. However, somebody's tissue is going to be thinner and or thicker depending on that person. So like underneath eyes, that may be really thin and you may have to take and dial that down a little bit. But if you're microneedling and you have the experience of microneedling, you know how to adjust those down. I'm not going to start with 2.5, the deepest that you can go, which assures that you're in the dermis. So if I'm going to be doing a line or a static line or something that I really need to get in a scar, then I may dial it to the deepest that I want to go. But that is basic microneedling. That is, and we're not here to give a course on microneedling. But the idea is you have to vary that according to a thin forehead. I have a really thin forehead. You put 2.5 on me, I'm going to bleed like crazy. So you have to adjust that when you have that patient on the table. But you want to remember, you're not here to be going the lightest as possible. You want to go as deep as you can in that area for which you're doing it.
And Denise, at the beginning of our webinar, you mentioned that it should sit and reconstitute for about 30 minutes. So just as a brief overview, you're going to add 8 milliliters of sterile water into that 250 milligram of dry powder in your vial. You're going to shake, 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 shake for 1 to 2 minutes, wait 30 minutes, and you can periodically shake it again. You really want to make sure that it gets that nice serum-like consistency for the hydration of the product. And then if you choose, it's totally optional, you can add another 2 milliliters of water, your sterile water, or 2 milliliters of lidocaine, depending on, again, your preference. And they're going to shake strongly again, and then you're ready to rock and roll.
Yes. And I think it is important to say that when you're mixing this, unlike some of the other drugs that we mix for serums, those mix very easily. And when you have 1,000 of these little threads, you are going to need that time to actually get it hydrated and to where there's no clumps. Because if it's not hydrated and not shaken enough, you will end up with a little clumping in there, but it will hydrate if you give it time. But it's a little timely manner planning on your behalf so that it doesn't interfere with your treatment.
Excellent point. We're going to watch another video here in just a moment of Dr. Lynn Worthington, again of R3 Anti-Aging Studio in Brentwood, Tennessee. And she is going to be microneedling in Renveau mixed with PRF. So really, really, again, cutting edge, revolutionary. Other treatment modalities, Denise, that you like to use Renveau for?
I have done a lot of PRF, but I use it with exosomes, and I can mix it with the exosomes because I think exosomes are a little bit stronger. So I like the versatility of this powder, that I can actually mix something and know that it's not going to alter either ingredient. So that is a bonus. And putting it on over lasering, I do a lot of CO2 laser and I smear it right on after I'm getting done lasering. So that has been a win-win as well. So not only microneedling, as a nurse practitioner, I don't do as much microneedling as I do laser. I also do hair restoration, and I microneedle and put PRP or exosomes in the hair. And this is a nice little additive because we've got a lot of data saying that the threads can actually help stimulate hair growth. So actually I incorporate that in there because I figure it's inexpensive and it is a win-win. If it works and it helps it actually is like a little booster in there to make this work because there's so many variables with hair restore. So to me, it's like a nice little additive to put it in there. So it's relatively easy to use. And it's just an additive that doesn't become very expensive on the end of the patient as well. So it's very affordable to the patient, and it just gives them a little bonus onto the treatment that they're already having.
Which in the chat here, we keep getting the same question. How much do you charge? And I know as an industry standard, it really varies by location and geography, but our standpoint is generally $250 to $450 as an add-on to another treatment procedure, $750 as a standalone microneedling treatment. Denise, what are some of your pricing guidelines with this?
I'm in Tampa Bay, which is a bigger area of injecting and for these types of procedures. So I have to really stay within the price range and not really go out too far. With a laser add-on, I do 400 as a laser add-on. And usually when I'm lasering, I'm doing face, neck, and chest. So I use the whole bottle, right? I know that you can use them for several people and you can use them for 3 different people. I do larger areas, so I definitely want to get the benefits of the 1,000 threads. And if I have a patient that's not so aging and maybe on a younger side, then okay, then I can maybe not use the whole bottle. But it's affordable enough to do that. So I want to give them the best that I can give them. The pricing for our microneedling is basically like $500 for microneedling, and then you add on your whatever you're going to do. Now, the Mac Daddy treatment or the ultimate treatment, when I do exosomes and I do Renveau with the microneedling or the laser, that's going to be an additional $400. So then that becomes $800 additional. But it's still affordable for people who really want that great addition.
Especially when you see the results immediately, and it's the gift that keeps on giving. It's incredible.
Right. Yeah. And I think with anybody, a lot of our patients are aging and they have wrinkled skin and they have some static lines and their skin isn't really taken care of that well. Even though they want a laser and they want to get their skin better, sometimes they're just like, they need some help. So what we actually do is lay out a plan for them. Okay, you're going to need 3 of these. And this is how much it's going to cost. We're going to do it every 4 to 6 weeks. And you're going to have a much better outcome if you do something 4 to 6 weeks. And I think that's with anything in our business. I don't promise anything with one laser, and I'm definitely not going to promise anything with just one treatment. So every 4 weeks you get it done. PRP, we do every 4 weeks until you get your result. So you use this as a same protocol per se for those types of things that you were using your PRF for.
Well, let's watch our PRF video. Here we go.
Hi, I'm Dr. Geneva Worthington, and we are here with Miss Bonnie today, and she is our model for the Renveau and the PRF. So what I'm doing is I'm mixing the Renveau and the PRF back and forth, and we're going to microneedle this in on Bonnie's face. So we're using about 3 cc's of PRF and 2 cc's of Renveau. Since the PRF needs to stay cold, I'm going to give this to Lorraine and she's going to put it back in the ice. So we're going to start on Bonnie's forehead with the Renveau and the PRF. And I got about 1 cc mixed equally in here of that. And we're going to go at a very shallow depth of about 0.25 to 0.5. Bonnie has been numbed with some BLT cream, and she's been sitting for about 25 minutes. And so we've cleaned all that off, and we're getting ready to start the massage. So I'm just making one pass and putting just little droplets of the PRF and the Renveau. This is a really good product for superficial use. I typically like to use the product have patients come in about every 4 weeks for a series of 3 of these, and the results last for a good long time, typically about a year. Bonnie's got some superficial lines right around her eyes, commonly called the crow's feet, and we are microneedling very close to the eye, so we can put the Renveau right through here and just kind of plump those up for her. And you can see it's amazing that they're already plumping just from that one pass. Bonnie, are you still doing okay?
Mm-hmm. Yeah.
And I'm at a 0.5 on the depth right now, and again I'm just making one pass. And then the Renveau. She's also got some little fine lines right here close to her ear that we're trying to take care of as well. It absorbs very nice. It's amazing what it's doing for those crow's feet around your eyes already, Bonnie.
I can't wait to see it. Excited.
Turn your head this way, please. We're going to work on the other side over here a little bit. Again, we're at a 0.5 depth, and we're getting kind of close to her eye. And we're just creating little micro channels to place the PRF and the Renveau. So using the PRF with the Renveau is a very good way to accentuate both products. It's kind of like throwing gas on fire. It makes the product last longer and work much better. You can use it alone if patients do not want to do the PRF. Typically we charge for this procedure the microneedling charge, plus on top of that the Renveau and the PRF charge. For the Renveau, it's going to be somewhere around $250 to $450 depending on your area that you're working in and what your market will bear. It's amazing how those are just fading away, Bonnie. Those little lines look so much better. So far I've used about 2 cc's of PRF and Renveau. So what is Renveau? Renveau is a PDO microparticles, and it also has HA in it, so it gives you the immediate plumping effect. And you can see that she's got very little redness from doing the procedure. It's anti-inflammatory in nature. Just creates a nice plump. The microneedling itself would be somewhere between $2.99 and $3.99, and then the Renveau added on top of that would be an additional $250 to $450 depending on what your market would bear, and then you would just add on the cost of your PRF. So I recommend having 3 treatments about every 4 to 6 weeks apart for maximum benefit.
A special thank you to Dr. Lynn Worthington and her team up at R3 Anti-Aging Spa. Amazing location up there. Thank you, thank you, thank you. And thank you to Denise. We've had lots of great questions coming in through the chat tonight. So we will do our best to keep reaching out to you guys and answer all of those questions. But really, I truly hope your takeaway is that Renveau is not only an affordable treatment plan that is incredibly versatile, but it also allows you to customize your patient's results so they can really start to see a dramatic difference in their overall treatment moving forward. And I hope that this helps you position yourself as a leading expert in the field of PDO. Thank you very much. Have a great night, everybody.
I always say, just get it in the skin.
Love it, Denise. Thank you. Thank you.